What's my video quality like? Is it fine?
Yes, it is.
All right, thank you. Just wanted to be sure.
Smooth 98.1, love music, love life, all the things you want from Tony Momorel. This is Breakfast in Bed. My name is Oluwaseun and this is Smooth 98.1, love music, love life. So it's been a very wonderful time with you this beautiful Saturday morning, 26th of June, 2021. The time right now is 4 minutes past the hour of 8, and this is the soul food segment of Breakfast in Bed 981. Now, I did give you teasers earlier on that the conversation we'll be having this segment is centered on male infertility because it is Men's Health Month. June is actually Men's Health Month. So because of that, we'll be talking about something that is not often talked about, and that is again the topic of male infertility. I have my guests joining me via Zoom, and you know that we are streaming live on YouTube. So just go to YouTube and search for Smooth 91 FM Lagos, and you'll see us right there. And also that's for you in case you are missing out, or maybe you know somebody who is missing out on this already. So you can send the link to them after we are done so that they get to catch up on the conversation. Now, if you want to be a part of this conversation, the number to dial is 01-448-9981. And then your WhatsApp messages go to 0809-444-0981. Again, the number to dial is 01-448-9981. And then your WhatsApp messages go to 0809-444-0981. Joining me this morning is a urologist. He is Dr. Onyeze Chigozie. Good morning. Hello.
Yeah, good morning. And
good morning. I thought you were frozen. Can you hear me?
Yes, very well.
All right, thank you. Oof, my heart skipped a bit. I guess the rain is interfering with the network this morning, and we hope it allows us to have a smooth conversation. But yes, thank you again for joining me this morning. I really, really do appreciate it. So let's get right into the topic, shall we? When we talk about male infertility, of course, we know that we're referring to the male, and then it has to do with them. So how would you say, how does it, I'm looking for the best way to put it now. What does it mean to actually be infertile as a man? Let's just say it right there.
Well, you don't talk about infertility without talking about the man and the woman, because it takes two to make a baby. It takes a man and a woman to actually make a baby. Yeah. Although each party could contribute to infertility. Well, if you ask what does it really mean to be infertile, we actually have a definition of that, and that is the failure or inability of a couple seeking to have children to have that within 1 year of uninterrupted or regular sexual intercourse. Sexual intercourse, I mean, has to be non-protective. You can't be having using condom and say you want to have children, and it has to be penovaginal. You can't be having it otherwise and think you want to have children. So if you're having regular unprotected penovaginal sexual intercourse for up to 1 year with the intention of having children, and you're not able to do that, then we could say such a couple is infertile.
Okay. So that means if it is not up to 1 year, you have no right to just open your mouth and say, maybe I am infertile as a man or as a woman.
No, I mean, you see a couple just got married 3 months ago. You can't say they are infertile. Somebody just got married about 9 months ago. You can't also say they are infertile. Actually, what has been known from studies is that about 20%, just 20% of couples will have children at 3 months. About 50% perhaps will have within 6 months. 75% will have at 1 year. Okay, so it is after 1 year that will now say, oh, these guys are not able to have children. They may have fertility issues.
Okay, I hope the Nigerian mother-in-laws are listening to this right now, because they are very much well seated on this table. And generally, parents or intrusive people who, you know, the normal prayer they give you on your wedding day. In the next 9 months, we'll come and carry baby. In the next 9 months, we'll be singing a different song. So yes, you cannot say a person is infertile, especially when the marriage or the union is just less than a year. Thank you very much for establishing that. Now, earlier, I also rolled out a data. I said, according to a report, actually, according to a study that was done by Patrick Ojeifo Wadia and also Abiodun Matthias Emopai, which was actually published in the Journal of Basic and Clinical Reproductive Sciences. Well, that was in July to December 2015, specifically volume 4, issue 2. So you can check that out. It was said that in the Southwest, male factor was responsible, or rather reported to be responsible for 42.4% of infertility cases. That was in the Southwest. Now, while in Maiduguri, that's in the northeastern part of Nigeria, male infertility is the reason for about 40% of all the gynecological consultations. That's Maiduguri. Now, moving to Kano, the report said 40.8% of the prevalence of male infertility was reported. Now, going to Ile-Ife, 46% was the number. And meanwhile, in Enugu, the eastern part of Nigeria, 55 to 93%, sorry, 55 to 93% of the prevalence of the infertility cases were from the male. Now, in your years of experience as a urologist, somebody who is very, very entrenched in this field, would you say that number is close to being true?
Well, part of the data you reeled out is from the center where I did my postgraduate training, which is Ile-Ife. And we have 46 as our value from what you read out.
Yes.
All right. So generally speaking, the data you've read out are not so different from what is obtainable internationally and generally accepted. It's actually said that 40%, generally speaking, 40% of infertility cases are male factor related. Another 40% are female factor related. And then we have 20% that is from both male and female. So sometimes when these guys come to the clinic for consultation, it is essentially a male problem. At other times, it is essentially a female problem. But there are times when the man has a problem, the woman has her own problem. And while the man is seeing the urologist, the lady is also seeing the gynecologist. Okay, so we have 40 for the males generally, 40 for the females, and we have 20% combined factor. So information you gave regarding the different geopolitical zones can be said to be correct. We have, it may stagger from place to place, except for Enugu, where we have that high figure that should be in their 40s.
Okay, all right. Thank you for laying that foundation, because we'll definitely come back to build on it. I want to really dig deep into why something that seems to have that number, yet people somehow in this setting, in the society that we are in, somehow just heap the whole blame on the woman. Yes, so we will definitely talk about that. But in the meantime, let's just all calm down. If you want to call in, the number to dial is 01-448-9981. And then the number to send your WhatsApp message to is 0809-444-0981. It could be a question, a contribution, or something you just want to clarify. I'll be right back. So just ad break, and we come back afterwards.
Okay. Is the video still on, or you've paused the video?
It's good. It's very on. Everything is still streaming.
Okay.
Colgate protect my teeth from cavities. Does it use cold food?
No, dear. Most tooth pains are caused by tooth holes called cavities. When you brush daily with Colgate Maximum Cavity Protection, its expert formula locks natural calcium in our teeth and helps protect them from cavities.
It's time to upgrade to the world's most chosen toothpaste, Colgate, because Colgate locks calcium in.
Keeps cavities out.
Colgate is recommended by the Nigerian Dental Association.
1xBet, oh, 1xBet. Everyone agrees that 1xBet is the favorite bookie because of the highest odds, fast deposits, ability to sell slips, bet insurance, and more. What's even more exciting about 1xBet is that you can make money from things like virtual games, basketball, horse racing, and more. Log on to 1xBet.ng to register, and don't forget to use the promo code RadioWin and get 200% bonus on your first deposit. 1xBet, bet for every taste.
Smooth 98.1 in conjunction with Content Factory Limited presents La Gosa, a radio drama series.
Story of my life.
La Gosa is the story of Michael Babatunde, the first mayor of Eko Atlantic, his life, times, and his accomplishments.
This is me, my victories, my failures as a man, as a husband. It's all me.
A political drama filled with intrigues, family conflicts, and the pursuit of destiny. Created by Tari Taylor.
All this is part and parcel of a life of service.
Playing the dumb wife who turns a blind eye to your infidelities. Starring Femi Jacobs, Olo Jacobs, Joke Silva, and Kemi Lala Akindoju. Coming to you Mondays to Thursdays at 8:45 p.m. on Smooth 98.1.
Politics of family.
All right.
La Gosa is sponsored by Eco Development Company, the builders of Azuri.
Smooth 98.1. Love music, love life. You know definitely that you can catch Lagosa every Monday to Thursday, 8:45 p.m. and then enjoy all the goodness that Lagosa brings. Now, this is Breakfast in Bed. The time check is 8:14 a.m. This is Smooth 98.1. The topic of conversation is male infertility, you know, the causes, the solution, and everything that we can take about the topic. And my guest is Dr. Onyeze Chigozie. He is a urologist. Thank you again for being my guest this morning.
Welcome.
Yeah, before going on that break, we were talking about the number and data on male infertility. So the question I have is, with that kind of number, why has it been made to look like the most problem has been with the woman? And why is it that we don't get to talk much about the topic of male infertility?
Okay, I think it boils down to tradition and beliefs. Before this time, they used to use the word barrenness. They say the woman is barren. I mean, I'm not sure whether you've heard that before.
Yes.
Yeah, so when they say someone is barren, it's usually the woman that everybody looks to. Okay, nobody talks about the man. Everybody looks to the woman, like, what's happening? Why are you not able to conceive? Like I said when we started, it takes two to make babies. It takes a man and a woman. So once there is a problem with that, ideally what should happen is that both people, the couple, man and wife, should be able to visit the doctor and then have a self-check. The woman perhaps would have to see a gynecologist and the man see a urologist. Sometimes the first port of call is actually the gynecologist because the woman is perhaps more concerned. We believe that if she's not able to have children in this part of the world, the man may have to get somebody else who can bear children. So sometimes the woman seems to be on the receiving end. She's more concerned. It is after she's gone to the hospital, perhaps, and the gynecologists have said, woman, you're fine. What's the problem? Can you invite your husband? That is when the man comes, you know, like a big man, and says, yes, doctor, I heard you were calling me. No, it's not exactly supposed to be that way, you know. Both man and wife should be able to come for a consult and have themselves check. But like I said, this should not be maybe in the first year of marriage. It should take their time. I mean, things may just occur naturally, perhaps. That's actually what I think regarding that. It's just more of a cultural or a traditional belief around this part of the world.
Yes, no doubt about that. And then we hope that with more education and talks like this, that mentality will get to be replaced, you know, that it's not just a woman or she should not bear the brunt. And still talking about that. So Nigeria happens to be one of the countries in the world. Now, we do not have official data, but then it happens to be one of the countries in the world that seems to have the highest cases of paternity fraud. So do you think downplaying this topic of male infertility, and like you said, when the woman has gone to check and she realizes, oh, there is nothing wrong with me, and then they call on the man, and the man says, oh, no, I am a strong man. I can do 5 rounds. I am fine. Nothing is wrong with me. Do you think this is actually one of the contributing factors to paternity fraud in Nigeria?
Yes, I think it is. A woman perhaps will do everything to keep her marriage and to keep her man. Sometimes that may mean having to do some malpractice. Okay, so I don't think that couples starting up in marriage would perhaps have paternity fraud as something they want to do or something they envisage. But perhaps they've stayed for a year, for 2, 3, and they're not able to have children. And the woman sees her doctor and he says, I'm fine. Perhaps the man is busy and is not able to come see his doctor, or is reluctant seeing his doctor. Sometimes such women may resort to self-help, have affairs, result in children, and then she gets pregnant, and then somehow will say, oh, God has blessed us, as we say in this part of the world, and everybody celebrates. But deep down in her heart, she knows that something is really wrong, but she has to cover up. She has to go the extra mile, perhaps, in her own way and thinking, to save her marriage. Okay, so this might be one of the contributing factors to the paternity fraud that is reportedly high in our country. I think it is one of it. Now, sometimes it may not also be because of infertility. It might just be some extramarital affairs not related to fertility cases. So you can have a child, legitimate child of the husband, and then maybe she undergoes extramarital affairs and gets pregnant and still brings the child back home. So it is not exactly, paternity fraud is not wholly related to infertility. Yes, infertility can contribute, but sometimes playful extramarital affairs may also be part of it.
All right, I have a call. Hello, good morning. What's your name and where are you calling from? Adi from Apapa. What do you what do you have to say this morning?
Yes, as the doctor in the house, there's this, I don't know, yeah, let me just.
Go ahead.
So there's this feeling I get around my scrotum, like there's this pain movement. Sometimes it's warm light, and I Googled the symptoms, and of course, I got to see stuff like varicocele and something along that line. And then I have this very tiny lump, apart from the normal uh, scrotum that men have, like two. I have this extra tiny one. And then I had gone to the clinic, and they would just look at it and said it's just some fluid there that I should ignore. There's nothing serious to worry about. But if I feel like I should take it out, I should sign up for a surgery if I really think I'm not comfortable with it. But it doesn't pain me, it doesn't. But that feeling I get, that warm-like feeling I get around the scrotum area or something like that, is what I don't understand. But they told me there's nothing to worry about. That it's just some vein movement, blood flow, and stuff like that. And from what I googled, the varicocele thing seems to be something that could make a man to be. So I just want to maybe doctor demystify people thing. Yeah.
All right, thank you so much for calling, Adi. He's listening to you and he will definitely say something about that. All right, have a good day. Okay, were you able to catch all of that?
Yes, I got at least most of the question and comments too.
So what do you have to say to it?
Yeah, I think we're still going to come to, when we come to the causes of infertility or male factor infertility. What he mentioned, varicocele, which perhaps could appear as scrotal pain or feeling of bag of worms, like he clearly described, is one of the causes of male factor infertility. And I will explain why and what perhaps can be done in the course of our discussion this morning.
All right then. So, well, I think that we should waste no time. Let's go to the causes of male infertility then.
Okay. Now, when we talk about male infertility, we know primarily that what the man actually produces, fertilize the egg produced by the woman, is the sperm. And the sperm is produced by the testes, okay? A lot of things regarding male infertility is actually related to the testes. So as urologists, what we do is to classify these causes as pre-testicular, testicular, or post-testicular. meaning things that happen before the testes, things that happen to the testes, and those that happen perhaps after the testes. That's actually what that means. Now, there are hormonal influences that have an effect on the testes and on sperm production. These hormones from the brain, pituitary particularly. So we have things like what we call the follicle stimulating hormone and all that. Primarily, that is what influences spermatogenesis, the production of sperm. But there are other things. There are other hormones perhaps that also have the same effect or similar effect. Things like prolactin levels, luteinizing hormone levels, and stuff like that. So these hormones really have an effect on the testes, and if they are not well coordinated, either they are under or excess, can have an impact on sperm production by the testes. So that's for the pre-testicular. When we now come to the testicular, there are a number of things that can affect the testes and make the testes not to be able to produce sperm like we want it to do or like it's supposed to do. One of the things could be congenital. Some people could have perhaps chromosomal abnormalities that could impair sperm production. So those are gene problems, okay? Some other times it could just be the environment around which the testis is located. Now, one distinct difference anatomically between the man and the woman, the ovary that produces what's it called, eggs in the woman, is located inside her body, inside the abdominal cavity. But the scrotum for men is located outside.
Outside.
Yes, and there's a reason for that. There's a reason why the testis descends into the scrotum, and that's because sperm production should occur at slightly lower temperature than the core body temperature. Usually we say sperm, the optimal temperature for sperm to be produced is between 2 and 4 degrees Celsius lower than the core body temperature. Now, anything that tampers with this temperature could affect sperm production. Okay, that is one of the ways, or one of the ways where varicocele comes in, because the varicocele, like one of our callers mentioned, refers to dilatation of the veins of the testes, or the veins that should drain the testes. And when these things happen, the testis is actually at slightly higher temperature, okay, than should naturally be. There's what we call the countercurrent temperature exchange, which perhaps is affected when people have these dilated veins. So the testis would be at a slightly higher temperature and will not be able to produce sperm the way it should. That's one. And even when it produces, these sperms perhaps might be deformed. So they may not have a good shape, or what we call morphology in medical term. And then even if they have that, they may not be able to travel fast. They may not be able, that's what we call the motility, may actually be reduced. So you have an abnormality in both the counts, the sperm count that you get, in the morphology, that's the appearance, and also an abnormality in the motility. When man and wife have sexual intercourse, sperm is actually deposited in the vagina, and this sperm would have to travel way up the genital tract of the woman where fertilization occurs. So if the sperm is not able to travel, that could also be a cause of infertility, and that could result from varicocele. So there are some other things that perhaps can affect the testes. Sometimes drugs. Some people are on chemotherapy, maybe for cancer treatment and all that. That could also affect sperm production. Sometimes it could be trauma. Maybe somebody is having active spots and they've hit his testes and stuff like that. That could also affect it. And then we move away from that to post-testicular. Post-testicular actually means that the sperm has been produced, but it's not able to get to the female genital tract. There might be an obstruction somewhere. Okay, so somebody does a semen test and they say they didn't find any sperm. Okay, that sometimes may be because there's an obstruction. So that's actually what we call a post-testicular. So these are some, just highlighting some of the causes of male factor infertility as is seen in our practice.
Wow, thank you very much for that very detailed one. I'm sure there are other causes too. But then while you were talking about the temperature, how the temperature of sperm production should be about 2 to 4 degrees Celsius lower, I thought about the clothes. The clothes men wear, their trousers. I mean, I've seen some things that said men shouldn't wear tight-fitting jeans or trousers Is that the truth?
Yes, that's actually one of the things we counsel people who are seeking treatment for infertility. Anything that will raise the scrotal temperature should be avoided. Okay, tight-fitting pants and underwear should be avoided. Perhaps tight-fitting jeans should also be avoided. We talk about long-distance travelers. Sometimes these long-distance travelers, the heat drivers, the heat generated from the trunk of their car or their lorries and all that sometimes could also affect sperm production. So generally speaking, anything that will raise the intrascrotal temperature is actually discouraged, whether clothing or work exposures and things like that. They're actually discouraged.
Thank you. And while you were saying that, I also thought about people who put their laptop on their thighs, because that's a very common one, right?
Yes, actually, because of the heat generated, from the laptop. So we'll prefer you keep it on a flat surface, or even if you want to keep it on your lap, you might have an intervening surface on which you keep the laptop and not directly on your thigh.
Thank you so much. Like I'll say, I'm sure you're listening and then you're picking your size, so that if there's anything you're guilty of, please just try and adjust. Let's take another breather. And when we come back, we'll be talking more about the causes of male infertility. This is Breakfast in Bed.
What does future forward banking mean to you? Speed, innovation, convenience, lifestyle goals, or just simply getting service that is designed just for you? Yeah, we thought you might like all of that and more. That is why we specially created Providus Bank for you to take care of your daily experiences. At Providus Bank, we believe that banking should be all about you and your business and how to get you to the next level. If you do not already have a Providus Bank account, please speak with our business concierge on 0700 77 684 387 or email businessconcierge@providusbank.com to switch to a future forward banking experience. Providus Bank, future forward banking.
Uncle Dentist, what are cavities? And how does Colgate protect my teeth from cavities? Does it use Kung Fu?
No, dear. Most tooth pains are caused by tooth holes called cavities. When you brush daily with Colgate Maximum Cavity Protection, its expert formula locks natural calcium in our teeth and helps protect them from cavities.
It's time to upgrade to the world's most chosen toothpaste, Colgate, because Colgate locks calcium in.
Yes, cavities out!
Colgate is recommended by the Nigerian Dental Association.
Smooth 98.1.
Hi, this is Layla Hathaway, and you are listening to Nigeria's #1 station.
That's right. Love music, love life. You are listening to the smoothest dial on Lagos Radio, Smooth 98.1. My name is Oluwaseun and This is Breakfast in Bed, and my guest is Dr. Onyeze Chigozie. The topic of conversation is male infertility, the causes, the solution, and everything about it. Now, we've talked about some of the causes, the I can't be such a terrible student.
Post-testicular.
Thank you. All right. So what are some of the other things that maybe we can really, the English seems big, but then something that, say, risk factors specifically, let's start with those ones. Some of the risk factors, some of...
Okay. So I just before we went on the break, I was about to say something about sexual intercourse. Because of course the means of transporting the sperm from the man to the woman occurs during sexual intercourse, except of course we're doing an assisted reproductive technique. Now, if a man is not able to have erection, he'll be able to penetrate his wife, perhaps, or his partner, and he will not be able to deposit sperm where it should be. So one of the major causes of infertility is actually erectile dysfunction, when people are not able to have adequate or good enough erection for sexual intercourse. So we have patients who perhaps are not even able to achieve erection at all. That's serious. You won't be able to, of course, have sexual intercourse and be able to deposit sperm where it should be. That's one of the things. And then sometimes people's sexual habits. There are people who love to use lubricants, either oil-based lubricants or others, and this sometimes can impact on the motility or the ability of swim up the female genital tract. So somebody is having sex and is using gel and stuff like that. And then some of these lubricants, they also have toxic effect on the sperm. So there are spermicidal chemicals in these lubricants that people use during sexual intercourse, and that should be discouraged in people seeking to have children. Okay, then of course, I take it for granted that if you're wanting to have a child, you know you will not use barriers. You won't use condoms, either male condoms or female condoms during sexual intercourse. It is also taken for granted that the woman is not also on contraception, because sometimes you say, I want to have a child, but the lady is on contraception, either oral or injectable contraceptive agents. You know, so these are some of the things that people should actually look into to say we're intact for that. I mean, if you want to have kids.
Thank you so much. So while you were talking about erectile dysfunction, I thought about something that is commonly said by some people. So when we're trying to address this, when they are trying to put the possibility that, okay, the infertility being suffered by the couple, say that's already after maybe 3 or 4 years, whatever it is. And some men go with the line, oh, I am very good in terms of erection. I have a long period. I mean, I can go 5 rounds. I can go 3 rounds. That is one. And then the second one is, oh, some men actually tell you, oh, the sperm I produce is actually quite thick. You know, it looks good. It looks fine and all that. So those two things are actually common. What's the word now? I think misconception. So I need you to please clear that up. First, the duration of erection or the duration of the sex, does it have anything to do with fertility? And secondly, the quality, or rather the look of the sperm, does it have to do anything with that too?
Okay, so sex is basically for pleasure. So having to go multiple rounds of sexual intercourse does not translate into being fertile or having good sperm. Okay, so we should know that the erection is just a means of transporting sperm that is produced. Erection and sexual intercourse is just a means. So somebody can actually have, say, obstruction to his vas deferens, which is the tube that takes sperm from the testes into the urethra. Somebody can actually have an obstruction and still have fantastic erection. Okay, so that should not that they don't go hand in hand. It doesn't entirely mean that when you have good erection that you are automatically free of all forms of male factor infertility causes. Now, on the other on the flip side, the look or the feel or the appearance of the sperm that is, or the semen that is produced, I think I should make a differentiate between sperm and semen. Sperm is actually produced by the testes, but those tiny cells cannot jump out by themselves. They need a medium through which they can move. And that medium is what we call the seminal fluid. About 80 to 90% of seminal fluid is actually produced by what we call the seminal vesicle. It is not the testis. It only produces that or gives that conducive environment for the sperm in which the sperm can travel. Okay, the seminal vesicle, what's it called, contributes about 80 to 90%. Prostatic secretion also contributes, okay, some 5% thereabouts. The sperm itself is just about 1 to 2% of that thing the man is talking about, of the semen he produces. So you can have 2 mils or 2.5 mils of semen and say, yes, I produced enough. Okay, but that's just seminal fluid. There is no sperm inside, or if perhaps there is sperm, either the morphology or the motility may be affected. Okay, so the gold standard for checking whether the man has good sperm or not is actually a sperm analysis. Sperm analysis is done in the lab and not just by visual appearance of the semen produced. So people should take away those misconceptions. If you think that you have good sperm, then subject it to an analysis in the lab. Perhaps we'll talk about how that is done in the course of our discussion if there is time.
Thank you so much. So that puts it to rest that if there is a case of infertility going on, please just leave your ego at the door and do the needful. Submit it if the need be. Go for the test. It's for the good. Now I have this one coming from Ali. Ali says, "Is olive oil, coconut oil, or shea oil advisable as lubricant instead of the regular ones people buy in the pharmacy and health clinics?"
Yes. I would want to talk about some of those oils. The oils are actually viscid. They have high viscosity. And like I said, it can impair the, what's it called? It can impair the motility of the sperm. So for couples seeking children or who have fertility concern, we advise that you stay away of lubricants completely. If you're going to use anything, why not use water? Okay, that the density of water is just 1 gram per cm cube, like we learned in preschool and all that. Okay, so why not just use water? But by the time you start using oil, either olive oil, coconut oil, Vaseline, jellies they produce or they sell in the pharmacy, by the time you start using any one of these things, it could actually impair. Yes, I know it makes for smooth sexual intercourse, less pain, less friction, and things like that. But if your goal is to have children, then you should stay away from everything that perhaps could limit that desire to have children. Another way to go about it is to, of course, we've not talked about it. It's not every day you have sexual intercourse that you are likely going to have children. It has to tally. The sexual intercourse have to align with the period of ovulation for the woman. So if you must use a gel, why not use it when perhaps the lady is not ovulating? When you know the chances of having children, okay, is slim. Okay, but once it is business sex, and this sex is to have children, child-oriented sex and all that, if you're going to have that, then I think that you should stay away from all forms of lubricants as much as possible. And I also want to advise couples that they should actually, together, the man and wife or man and partner, should be able to say, oh, I'm having my period now. In the next couple of weeks, say 2 weeks, I would ovulate. So sexual intercourse should concentrate around the period of ovulation. So people walk into the clinic and you say, are you aware of your wife's ovulation period or fertile period? And the man says, no, I'm not even sure I've heard anything like that. So how do you want to have kids if you've not been able to plan? So ladies have this monthly cycle, okay, where they menstruate. But the eggs are actually released 14 days before the next cycle. So if you're using a calendar method and you know, oh, I'm going to see my next period on the 28th, 2 weeks before 28th is 14th, you're likely to ovulate around the 14th. So sexual intercourse should concentrate around that. Okay, so people should have that in mind when they have concerns about having children. So the timing of sexual intercourse is very important if you're going to have kids through sexual intercourse, of course. If you're doing assisted reproductive techniques, timing is not important. We just harvest the egg and then get the sperm and do that IVF for them.
Thank you. So I definitely have more questions to ask you, but then let's take another break. When we come back, I also want to get into the risk factors. I'm talking about lifestyle choices. I'm talking about nutrition. I'm talking about the weight, the body weight of the man. I'm talking about maybe age and all other things that could serve as a risk factor for male infertility. So please stay with us. The program is Breakfast in Bed. The topic of conversation is male infertility. My guest is Dr. Chigozie Onyeze, and this is Smooth 98.1.
Hello, everybody. I'm Colin Jasuko. Stay tuned to Smooth 98.1. Love music, love life. Extraordinary.
There's an interesting question here that I don't know if I can ask on air. It says, I also want to ask the doctor if regular masturbation can trigger infertility or enlarge prostate.
Well, I don't think there's a relationship between masturbation and infertility.
I've seen something like that before. Some publication.
Okay. What did they say in where you read?
Yeah, saying that if you masturbate frequently, especially, that you are likely to become infertile as a man.
No, dear. Most tooth pains are caused by tooth holes called
Okay, that may not exactly be a direct cause. Relation. People who masturbate sometimes may end up having some form of what's it called, erectile dysfunction in the future. So that may indirectly affect fertility. Okay, sometimes they do not have the desire to have sex with people physically. They prefer to self-satisfy themselves. So that perhaps may be what's called maybe a link or relationship too.
Solution. Okay, we're going in.
So much to talk about. So little time. Rewind. Catch the top 5 at 5 on the Smooth Drive.
That's right, only on 98.1. That's top 5 at 5 every weekday on the Smooth Drive, where you have all the juicy, interesting conversation, sometimes the odd stories, and sometimes the news articles that just make you sigh. Then you can catch the host of the Smooth Drive every Monday from 4 to 9. This is Breakfast in Bed, and the topic of conversation is male infertility. This is a soulful segment of Breakfast in Bed, and we have been on this topic for about 30 minutes thereabout now. My guest is Dr. Chigozie Onyeze. So before going on the break, I said that I would like to also get into some of the possible risk factors. Let's start with weight. Does the weight of the man have anything to do with a possible infertility case?
Okay, so I won't really say weight. Perhaps I would relate that to obesity. Okay, yeah. You could have a tall man with muscular build, and that's not obesity once your body mass index is within normal limits. But obesity, yes, and infertility, there could be a relationship between obesity and infertility. Usually there is this balance between the male hormone, which is testosterone, and the female hormone is present in everybody, which is estrogen. So there is an androgen estrogen balance, which perhaps can be distorted in people who are obese, and that perhaps can actually lead to some form of subfertility. Yeah.
Okay, thank you. Now, I may not be able to take all the risk factors that I have before me. However, there is this one that I need us to touch on, and that's alcohol and drugs. So we know, yeah. So is it a possible cause? And tell me how it happens.
Well, I do not think that there is a direct relationship between alcohol and fertility. But one of the things that we know is that alcohol, perhaps when taking excess, can actually lead to some form of difficulty in achieving or sustaining erection. It may affect erection, okay? It makes you high, but you may not be able to have good erection. So that perhaps may be a relationship. But the more common thing that can actually affect sperm production is actually smoking, okay? So smoking, we tell our people quit smoking, and then we say reduce alcohol. So that's what we say in clinic: quit smoking, reduce alcohol intake if you're going to, or if you have fertility concerns. So quit smoking, reduce alcohol as much as possible. Other things that perhaps we talk about is drugs. There are some drugs that people take. There are some drugs that people take for prostate conditions, maybe enlarged prostate. The side effect of some of these drugs is retrograde ejaculation. Okay, so that could be a risk factor too. So the man is taking alpha blockers for because he's not able to urinate properly, and then instead of ejaculating out into the woman, he ejaculates back into the bladder. That's what we refer to as retrograde ejaculation. That could also be a risk factor or a cause of some form of subfertility. Although these things can actually be addressed. Other things people talk about are medications, steroids, chemotherapy agents, and sometimes could also be a risk factor or a cause of infertility. So we actually encourage people to take lots of vegetables. It will help them. We actually ask that people should take less of saturated fats. Okay, we'll say that people should take more of antioxidants. Okay, so when sperm is produced, it needs to be in this conducive environment, non-toxic environment. And one of the things that could create that good environment for the sperm is actually antioxidants, vitamin C, vitamin E, and the like. So if you have food that you know could contain some of these things, we encourage people to please have them, as it will help fertility.
Thank you. You've already touched on all the preventive methods that I would have asked you, so that's a very good one. So what are the solutions?
Okay, so we would have to treat each person as case by case thing. What is obtainable for A may not be obtainable for B. If somebody has hormone problem, of course, we should see a doctor, and then they run some tests, know the hormones that are abnormal, and then there are medications that we could give to correct such hormonal imbalance. If somebody has testicular, that's for pre-testicular. If somebody has testicular causes, say maybe he has varicocele, of course, you would want to ligate the varicose veins. And that can be done in the, of course, you have to come to the hospital to have that sorted out. Just a minor surgery where we ligate the varicose veins, and the guy gets better. We've had patients who had varicoceles that we had surgery for, and then down the line, wives get pregnant, and they send you this wonderful SMS and perhaps invite you for naming ceremony. Have the time to attend. Okay, so if somebody has post-testicular causes, maybe he's having erectile dysfunction, yes, there are medications that we could use for such people that will be able to help that. If somebody is on drugs that perhaps can affect the mode of ejaculation, giving retrograde, then some of those drugs could be changed or substituted. If somebody has practices like maybe use of gel, use of oil-based lubricants and things like that, then they want to stop use of those things. Like we said, quit smoking. These are some of the things that people could do as a way of treatment for them. But usually it is a case-by-case scenario. And then we encourage people to show up in clinic, and then let's have a look at them and solve their problems as the case may be.
Thank you very, very much for doing justice to the topic, because I'm sure that it has been fully answered. And Ade that called earlier, I hope he has been able to get an answer to what he requested or the clarification he was seeking. So that's very important, that as we always say, nutrition or health generally, it is very individualized. So that's one reason you always need to go in to check, especially if you notice something is wrong with you. And brings me to another thing that I always say, be in tune with your body, just in case you notice something funny or something unusual about yourself. You should definitely go again to check your medical or your health specialist. So Dr. Chigozie, if people want to reach out to you or catch your services or seek out your advice or something, how can they do that?
There are platforms online where they could book and then get across to us. We'll see them. There's one I sent to you on WhatsApp. I think it's Doctora also. So yes, we could just book on some of those platforms, and then we see them and give them the needed health advice or treatment as the case may be.
Are you active on social media?
Not so well.
This is 2021, and trust me, telemedicine is a big thing.
Yeah, no, actually, telemedicine, yes, we do a lot of online consultation for people, but not necessarily. I'm not an Instagram person. I'm not a Facebook person. So when you say telemedicine, yes, I do a lot of online consultation, but as per showcasing what I do, I don't carry my work to Facebook and Instagram and all that. Maybe I will, maybe.
Just maybe. All right, then. So if you want to reach out to Dr. Onyeze Chigozie, you can go to the Doctora platform. That's www.doctora. Now, Doctora is spelled as DOCTOORA.com. So search for him. He's a urologist, and then you will see him right there. You can book the consultation and maybe get his number for other things. And then if you want to share this broadcast with somebody who you think should have this information at hand, or you feel this is very important, you can share it with them. Just go to YouTube and search for Smooth 981 FM Lagos. Again, Smooth 981 FM Lagos. And then you see the repeat broadcast up there. You can share it. And then also I will share it on the WhatsApp status, so you get to catch up on it if you have missed it. And of course, we answered some question in between it, especially a question from Ali. So he asked a very interesting question. So you should go back to catch that too. So thank you again, Dr. Chigozie, for being my guest. I look forward to more conversations, maybe not on this topic, but generally, on your specialty.
Problems.
Thank
Always
you.
at your service. All right. Thank you very much.
All right. Thank you.
Yeah.
So Lagos, that's it. The rest of the world also, that's it for Soul Food segment this morning. Now in the 9 o'clock hour will be time for the Smooth Explorer, where we talk about entertainment and other things. I did say that I have something to ask you, something interesting. Of course, I'm going to be giving you the entertainment gist and vibes and chats, but then there is a question I would like you to answer. Please come around in the 9 o'clock hour for that one. This is Smooth 98.1.
Are your music station?
Yes. Smooth. Hi, this is Michelle Dede. Keep listening to Smooth 98.1.
Thank you for staying tuned to the stream. We go. This is one of my jams.